Welcome! Today we're going to discuss the Treatment Plan Financial Worksheet. This is the first in a series and gives an overview of this functionality of DDSGP. As always, we recommend using two devices while learning. One to view these instructions, and the second one, your iPad with DDSGP installed, to follow along in real time. Ready? Let's get started. The Treatment Plan Financial Worksheet is available in the lower row of icons of the icon menu, or from the sidebar. This overview explains the philosophy behind the worksheet. Then, 3 additional sections walk you through how we use it in specific patient scenarios: patients with no insurance, with out-of-network insurance, and with in-network or in-house insurance. We've separated these scenarios to keep things concise and help you focus on the one most relevant to your office. The purpose of this worksheet is to replace the often cluttered, overly detailed printouts generated by traditional practice management software. Those printouts usually include procedure codes, tooth numbers, provider names even when there's only one doctor, and columns for regular fees, insurance write-offs, and patient portions. This overload of information can be confusing, especially when the page contains dozens or even hundreds of numbers.
Oh my!
The worksheet cuts through that noise and focuses on what truly matters to most patients, the bottom line, and a simple explanation of how it was calculated. Its clean layout makes it easy to walk patients through the math in a way that's clear and easy to follow, something you'll see demonstrated in each of the scenario-based sections that follow. To be clear, this isn't about withholding information. If a patient wants the detailed printout from your practice management software, you should absolutely provide it, especially for those who appreciate full data or want to double-check every line item. But for most patients, that level of detail is unnecessary and often overwhelming. This worksheet helps you present a clear, focused financial treatment plan that improves understanding and builds trust. When you open the worksheet, you'll see a screen titled Treatment Plan Worksheet with 3 main fields. First, in the patient name field, simply enter the patient's name. Next, you'll see this treatment plan is for. Use this space to describe the overall treatment being presented, not just a single procedure like number 3 crown. While it is certainly acceptable to use it for a single procedure, the best treatment plans are the ones that show the patient a path to complete dental health. Making numerous mini treatment plans is just confusing and doesn't convey to the patient how important it is to maintain the entire dentition. Then, in the total case fee (UCR) field, enter the standard fee for the full treatment plan here. This should be your usual, customary, and reasonable UCR fee. This is your normal full fee regardless of the patient's insurance status. If you're unsure where to find this number, consult your practice management software's help tools or support team. Once those fields are completed, you'll see a drop-down menu that allows you to choose whether the patient is non-insured, in-network insured, or out-of-network insured. Depending upon your selection here, the treatment plan worksheet will lead you down one of 3 paths that are discussed more thoroughly below. To get the most from this worksheet, continue on to the 3 scenario-specific sections. These will help you present treatment plans with more confidence, clarity, and success. As always, we encourage you to incorporate DDSGP into all of your treatment plans, no matter how big or small. If you have any questions or comments, please visit our website at www.ddsgp.com.